My name is Riley Dartes, and I'm going to be giving a speech on diabetes. Sugar kills. I'm sure we have all heard someone say, "I need something sweet now after having a full meal." Why do we insist on eating that mouth-watering chocolate cake after having a carb-filled bowl of fettuccine? In 2021, 38.4 million people of all ages had diabetes. That is 11.6% of the United States population. Diabetes was listed as one of the top 10 underlying causes of death in 2024. Though it is quite a common diagnosis, this disease can be very deadly if not treated or cared for properly. Many of us know someone who is diabetic, and maybe even some of the struggles they go through firsthand. It is important that we educate ourselves on this disease, not only for ourselves, but for the people around us too. This disease can be managed, and in a lot of cases, it can be prevented or even reversed. I am a licensed vocational nurse, and I have been helping patients for the past 6 years manage this disease. With this as my career, I know firsthand how this disease affects everyday life and overall health. Educating people about what diabetes is and how it is managed is important because it increases awareness, encourages prevention, and helps reduce the impact of disease on communities. I'm going to first explain the different types of diabetes. Next, I will provide some insight on what signs and symptoms you should look out for. And lastly, how it can be managed, prevented, or even reversed. But first, let's talk about the different types of diabetes. The 4 main types of diabetes we will cover today are prediabetes, type 1, type 2, and gestational. But first, let's discuss glucose. Glucose is a form of energy that your body makes from food. Too much glucose can cause you to become hyperglycemic. This means you would have a high blood sugar level. If your body is unable to produce enough insulin to absorb glucose in your body, you would be diagnosed with diabetes. The first type of diabetes I want to cover is prediabetes. Being pre-diabetic means you have a high glucose level, but the glucose level isn't high enough to be considered type 2 diabetes. If you are ever diagnosed with prediabetes, it is crucial to start monitoring your glucose and start working on strategies to decrease your chances of progressing. You are more susceptible of progressing to type 2 when you are diagnosed with prediabetes. Type 2 diabetes happens when your body doesn't make enough insulin or when the insulin isn't used properly due to insulin resistance. Basically, this means your body needs more insulin than normal to keep your blood sugar levels within a healthy range. Therefore, you would need to be ordered insulin or even oral medication from a physician to keep your glucose level stable. This type cannot be cured, but it can be reversed. Patients who are diagnosed with type 1 diabetes are insulin dependent. This means that their pancreas produces little to no insulin at all. The body's defense system attacks the cells in the pancreas that produces insulin. This means that type 1 cannot be reversed. If the autoimmune disease, it is an autoimmune disease that is lifelong. Type 1 diabetics are required to monitor their glucose levels up to 4 times a day. Lastly, gestational diabetes refers to women who are pregnant and have high glucose levels. This can occur due to certain hormones released by the placenta that make it difficult for your body to produce or process insulin. This form of diabetes makes the person more likely to be diagnosed with type 2 diabetes post-pregnancy. Though there are more than these types that I just covered, these are the most common. Any one of us can be a victim to this disease. It is important to be mindful of your own health and well-being to prevent any health complications. Now that we've talked about some of the many types of diabetes, we are going to move on to signs and symptoms of diabetes. You can have hyperglycemia, which is high blood sugar, or hypoglycemia, which is low blood sugar. These 2 symptoms of diabetes have different signs that you should make yourself aware of. Signs of early high blood sugar consist of increased thirst, frequent urination, headaches, and blurred vision. Signs of long-term hyperglycemia are fatigue, weight loss, skin infections, and slow healing wounds. Some signs of low blood sugar include weakness, sweating, chills, dizziness, lightheadedness, confusion, and becoming a pale color. Signs of severe low blood sugar include blurred or double vision, slurred speech, difficulty with coordination, and disorientation. If you were ever experiencing symptoms such as the ones we just discussed, it is important to contact your healthcare provider so they can further do testing to determine the cause. Untreated diabetes can lead to death. Now that we've discussed the types of diabetes and signs and symptoms of this disease, let's discuss how we can prevent and manage this disease. As we discussed earlier, when going over the different types, prediabetes is considered a warning sign. Type 2 can also be prevented and reversed. Type 1 cannot be prevented or reversed. Gestational diabetes risk can be reduced by carrying out healthy habits before and during pregnancy, but it can't always be prevented. Reversing prediabetes, prevention of type 2 diabetes, reducing the risk of gestational diabetes, and partial management of type 1 diabetes include exercising, losing 5 to 7% of your total body weight, eating healthy foods, and avoiding fatty and sugary foods. Avoiding unhealthy diet choices such as that chocolate cake that we all swear we need after eating that fettuccine is a great step in the right direction. Diabetes can be managed by oral medication, insulin, and monitoring blood glucose as ordered by a healthcare provider. Prediabetes and type 2 diabetes are also sometimes prescribed GLP-1 or GIP medications that come in both oral and injection forms. Most healthcare providers do routine lab work. In this lab work, they sometimes include a hemoglobin A1C. This test measures the average glucose level over the time span of 3 months. Along with this test, there are other ways to monitor your glucose, such as using a glucometer. Using a glucometer, you will need a lancet to prick your finger, an alcohol swab to clean your finger before pricking it, and strips for the machine to test your blood glucose. The average fasting glucose level falls between 60 to 100 milligrams per deciliter. You should care about the education of diabetes because knowledge saves lives. Education helps us prevent disease, recognize early warning signs, and even manage it effectively. In conclusion, making healthy choices can aid in longer, more comfortable life and prevent life-threatening diseases such as diabetes. Helping people understand diabetes and how it is managed is important because it builds awareness, prevents long-term issues, and reduces the impact on communities. You now know some of the main types, signs and symptoms, and prevention and management techniques of diabetes. Diabetes may affect millions, but awareness and education affect us all. The more we know, the stronger and healthier our communities will be. Thank you.